here today with Corey Murtha. We work together at the headquarters for Square One here in Western Springs, Illinois. Corey just passed his licensing exam to be a massage therapist here in the state of Illinois. We were just talking and he brought up delineation between tools and approaches that are organizational versus behavioral as it applies to the movement system. So I just thought what he had to say was really cool. So I said, hey, let's get the iPhone going.
Yeah, it was kind of funny just because I got through like the whole curriculum of like bodywork, massage bodywork, which is all based on tissue adaptation and tissue manipulation. It's not super indifferent from like the traditional exercise world, which is where I was before. And then there's like the intermediate time that I started doing Square One stuff the past couple of years. That was like the organizational tool. So before that, it was all about exercise, tissue adaptation. And then I had done Square One stuff and was like, holy cow, there's like organizational ways to get your clients results that one you didn't think were possible in that time frame or possible just in general. And also things that will last and then kind of add to the behavioral change that you make after you like Square One stuff. And then I went through like the whole, I wanted to make myself a little bit more dynamic in the industry. So I decided to go do a massage therapy thing. And that again is all about tissue adaptation, tissue manipulation. So you have tissue adaptation exercise, and then I went through the stage of Square One, which is all about organizational tools, and then you can apply that to exercise. And then I was like, okay, well, I want to do this. So I went back into the tissue world, which is tissue manipulation. What's crazy is, and what really gives you kind of perspective is, as we know that those behavioral tools work, where you're doing certain exercises, you can change your body's alignment, you can get stronger, you can get faster, you can do all these things, you can have better mobility, range of motion, flexibility, so on and so forth. You can also supplement those things with therapeutic approaches. But what's interesting is like both of those things, exercise and body work, generally are based on repetition, whether it's going back to the therapist over and over and over and over again and getting soft tissue work done or grasping or whatever, or taping or anything like that. And you go back to your personal trainer, which is just like specific exercises to solve a specific problem. This is the corrective exercise realm or the strength training realm, where we know that those things have been beneficial for long periods of time, especially just movement in general. But this new type of frontier that I came into contact with back in like 2017 with Square One was this whole organizational tool, which is basically when you have that client or patient who comes in who has pain, range of motion restriction, especially those with really bad pain and really bad range of motion restriction, like really these super suboptimal outcomes, how quickly those things can be changed when you first try to understand how their body is neurologically disorganized. Or there's like with Square One, we're working at gait, basically how the body ambulates, gets upright and then moves in the closed chain with the foot on the ground. If that's a disorganized system, your ability to get results are going to be hindered. If all you're trying to do is a behavioral approach to fixing that, whether we're looking at foot mechanics and basically foot orientation, how your foot actually strikes the ground, your arches, how that correlates with your hip complex and all that, which are fantastic. But then what they'll do is they subsequently give you a list of a bunch of exercises that you have to repetitively do over and over and over again. And then later down the road, whether it's a couple weeks, months, even years, for some people who are really, really bad, they'll have results. And I'm not gonna say may have, because there's definitely things out there that are giving people great results with that style of exercise, corrective exercise strategy, behavioral change strategy, postural change strategy, all those things, which certainly work. But if you can have an approach to first organizing a disorganized system, your level of outcomes and your results can be rapidly increased and way more profound than you think they could be. Like just very quickly and long lasting if the proper thing is organized. If you can truly organize the system, you can trick it. There are ways to trick it, which really fun stuff to mess with. We mess with them all the time. Just little things you can do to get better outcomes, a little more strength, a little more mobility. Whether or not those things last, it's usually a mixed bag. Oftentimes they don't, if it's just a little trick. But they're still beneficial, which is crazy because you can do. PNF is one of the first examples of that, where you can get range of motion increase just by contract, relax, messing with the spindles and stuff like that. Those are super useful things. But whether or not they're actually solving people's chronic problems in 1, 2, 3, 4 sessions consistently is rare, and it's usually maybe they accidentally organize them, right? Because the only way for the body really to change insanely quick is for there to be a neural adaptation. Has to be. Because structural change obviously takes time. And months, weeks and months for tissue change. And generally with behavior, the longer you have poor behavior, the longer it's going to take for correct behavior to correct the problem. That's generally the rule of thumb, where it's like if you have nasty knee valgus, or you have caved in arches, or you've got terrible hips, and you've had these for years and years and years, the idea that you can do a couple exercises and in a couple months, or even weeks or months, be much, much better is less likely. The younger clientele maybe, but the older clientele definitely not.
And as you were saying when we first started talking about this, what about the adherence issue for the patient?
How consistent are the clients or patients going to be with actually doing the protocol? Because that comes into play.
Right.
So what we found with a properly implemented neural corrective program, right, where you're actually assessing a system and how it's actually organized in itself. If you can make changes on that level, you'll see crazy reductions in pain, like scoliosis and Bell's palsy and valgus and squat technique deviations, things that you think would take repetition after repetition after repetition to change, actually change really quickly. And then even if the structure doesn't change, we do often see a big decrease in pain and increase in range of motion, but you'll still have people that have curvature of the spine, they have flat feet, they have knee valgus, but their pain is gone.
Right.
And what's funny is they had those problems way before the pain onset happened.
Right.
So if pain and posture and alignment are directly related, then you wouldn't have somebody who's able to have all these crazy deviations in their posture and distortions and not have pain. And we have those, people have those all the time. We always, every time we have people walk in here, we're like, how do you not have pain? You see somebody do some exercise, you're like, that's the ugliest thing I've ever seen, but the body's able to adapt. So that's why you can't necessarily throw out the idea that the nervous system is insanely intelligent, that we're just really just on the surface of trying to understand. And if you can understand at least a part of it and then intervene on that level, you can absolutely have profound, lasting results. It doesn't always happen. There's a lot of stuff out there where it's temporary, it's a trick, it's whatever, and those can be super useful and they can be sales gimmicks and stuff like that, so buyer beware. But there is stuff out there like we've seen with Square One, and that's the reason we keep mentioning is that's obviously Sean's the developer, and then I have the most experience with that system. There's some other stuff out there for sure, but with Square One, it seems to be the most consistent, logical, and the thing that I know the most about. So that's what we're going to talk about, where you're able to see profound, lasting changes on people who have had chronic pain for weeks and months and years, and the body is able to then handle it. It's able to rid itself of unnecessary, compensatory, whatever type of D word you want to use, dysfunction, deficit, distortion, throw them all out there. It can handle it. It truly can. So if you can get an organized nervous system, you'll be amazed at actually how it can handle those things with limited pain, pretty good range of motion. And then the best part is, as exercise professionals, then it's time to change behavior. Then it's time to, we're going to work out, we're going to do whatever type of behavioral they're adhere to, really. That's kind of the limiting factor. So whether you're into the functional stuff, the kettlebell stuff, the strength stuff, the CrossFit stuff, anything anybody adheres to is going to be the best program for them. It just gives you a tool like, let's first, we bring a client in, they have pain, they have range of motion, they have strength, they have problems. Let's see if we can organize, what do you say, pick the low-hanging fruit. Low-hanging fruit. If you're starving, you want the low-hanging fruit. You don't need to waste your time going up the top of the tree. You want the fruit that's readily available. It's going to make the biggest difference. If you can find something that's super impactful, that neural stuff, organizational stuff, do that first. If it works, beautiful. You have more resources to change your behavior with. If it doesn't work, change behavior. Behavior change always works. We just don't know the time frame. And when you're working in dollars and cents in the free market like we are, it's like the difference between being able to help somebody on the first session versus the 12th session is huge. It's too valuable and it's too consistent to not at least check out. We've seen it too consistently that it does last. Like we'll reach out to people like, hey, how you doing, or whatever, like, all the time. People are like, still great. Like, been pain free for name your month, name your year, whatever. It's like it's kind of wild. It's just a perspective from someone who is obviously in the exercise industry and then had to dip their toes in this whole organizational thing, and then they went back to a structural tissue adaptation based thing. And I kind of saw both sides, where it's very exercise, very hands-on, versus how subtle can we be, how specific is the nervous system, and then what are the most impactful changes. And what I've seen is I've seen the soft tissue approach, I've seen the exercise approach, and I know for sure the things where I've had the most profound change and what I've witnessed is obviously this organizational threshold right in here. And there's room for both. Obviously both come into play for sure, but if you're leaving the low-hanging fruit, if you're leaving off the organizational thing, you're gonna miss stuff, you're gonna not help people to the degree that you could or you wish you could, and you're gonna get paid less money. That's what we're gonna talk about, because everybody knows people like to go to the massage therapist, passive care generally, everybody knows they they go to the gym, but the reality is if you're not really helping people with their problems, you're in a, first of all, difficult industry, and you're in a low-paying industry.
Everybody's gonna move on to somebody else. Somebody else is promising them something that they may or may not be able to deliver upon. So.